Advocating for the Patient by Lena Hall. An advocate is defined as someone who pleads for the cause of another individual. Advocacy can mean preserving human dignity or promoting patient equality. The nurse's role as a patient advocate is powerful, requiring strengths such as courage, compassion, and competence. Nurses have the most interpersonal contact with patients, putting them in the best position to act as liaisons between patients, physicians, and families. Advocacy in nursing is unique from other careers. For instance, a lawyer may describe advocacy as pleading the cause of a client in the court of justice while protecting and supporting the rights and interests of individuals in politics, where patient advocacy in the clinical setting focuses on health conditions, healthcare resources, patient needs, and that of the public as well. Patient advocacy promotes patient safety and quality care, including protecting patients, being the patient's voice when they do not have one, and providing quality of care and interpersonal relationships and educating patients. Why is advocating important? Advocation for a patient is vital because it may reduce harm to a patient or the chances of error. Nurses may advocate for all types of patients, whether the patient is mentally ill, unconscious, or someone who might be uninformed. In some circumstances, a nurse will have to advocate for a patient who wants to refuse care or is unable to express their concerns about their care. Advocation is also important because a patient can be vulnerable, not able to speak for themselves or understand a treatment, and someone needs to step in and be able to do this. A nurse will need to build a relationship with a patient to understand what they would like for their treatment. It can even come down to how another staff is treating the individual. Dawood Van discussed in a qualitative study that patient advocacy consisted of themes of empathy with the patient. The themes included understanding, being sympathetic, feeling close to the patient, and protecting the patient, including patient care, prioritizing the patient's health, commitment to completing the care process, and protecting the patient's rights. Nurses can empower vulnerable patients, protect them from unnecessary treatments, deliver them from discomforts, and protect them from the actions of incompetent healthcare professionals. When advocating for a patient, there are defining variables. As a nurse and advocating for a patient, the nurse can be faced with many barriers. According to NACIA in 2020, the central theme of barriers identified was a lack of cooperation between healthcare teams, care recipients, and health institutions. Unsuccessful communication or collaboration can result in unsuccessful advocacy, resulting in increased complications, death, and negative consequences on the health institution and nursing profession. Patient advocacy enhances the quality of a patient's overall care. Unfortunately, when a nurse is not supported in advocating for the patient by the administration or facility they work for, it can make it more challenging for fear of being in trouble with administration or management. In some situations, it is not a fear of getting in trouble, but a lack of knowledge. A new nurse may question their ability and do not want to put the patient at risk or harm. During my research, I interviewed a fellow charge nurse. Their views on the importance of advocating and what they felt is essential advice for a new nurse stepping into the nursing field was discussed. This charge nurse expressed the importance of advocating for your patient as a nurse, and sometimes you're the only person who can be that patient's voice. The charge nurse discussed that in her experience, it is crucial to listen to our patients and what they want out of their care. She further explained that she viewed this as patient-centered care. She stated that sometimes it is not an easy job, which makes nurses an incredible asset to a patient's care. This nurse explained, you will run into circumstances that family members don't understand the choice a patient will make about their care. It could be the end of life care or even a treatment plan, and it is our job not to judge the patient's choice or the family's feelings and do what the patient has requested. This charge nurse further explained that it was challenging to her when working in end-of-life care that not all family members understood why the patient had quit trying or gave up. She said that it was challenging, but in the end, it is what the patient wanted, and she explained that she would validate the family's feelings, but in the end, it was what the patient wanted. The advice that the charge nurse recommended was follow your gut instinct. If you feel that something is wrong, it probably is. Don't be afraid to stand up for what you think is right. She continued to explain that even as a new nurse, you might be afraid, but that is normal. As you continue your career, you will build your confidence, and it's all part of the learning curve. In conclusion, patient advocacy is essential as a nurse and can be challenging at times. It is vital to advocate for the patient and what they want in their care. It could be as simple as listening to the patient and or even explaining something they may not understand. Sometimes it can be challenging, but as a nurse, that is part of being the patient's advocate to stand up for the patient and what is right for them and their care. It takes a strong individual to advocate for a patient and someone willing to listen and understand what the patient wants for their care. At times, an advocate may not agree with what the patient wants in their care, but it is important to understand and validate their feelings. Advocating for a patient is not always easy, but is essential.